My name is Tracy. I'm a student in physical therapy. Do I have your permission to feel some bony structures on you and record this for educational purposes?
Yes.
Perfect. The first thing I'm going to get started is I'm going to find the olecranon. The olecranon is located, we can see it a little bit better in this posterior view right here. It's located right here on it's a bony structure pointing out on the elbow. If we go a little bit more medially towards here, we find like a little ditch, and then this is called the ulnar notch. The ulnar notch is really where the ulnar nerve lives. If we go more medially from the ulnar notch, then we will come across the medial epicondyle. Going back to the olecranon, now going more laterally, we will find a ditch and then a bony structure, which is the lateral epicondyle as well. Since we're here in the posterior view, I'm going to find the tricep muscle, which is located in this bulky muscle bulk right here. These fibers run vertically, so in order to palpate this muscle, I'm going to just run horizontally. To see the muscle contraction, I'm going to ask my patient to push down their hand towards the ground, and you can see it pop up right here. That's contracting. Now going more towards the lateral side, I'm gonna have my patient in a handshake position right here. We will get started by finding the shaft of the ulna. If I go back to the olecranon, I can palpate the shaft of the ulna going right like this, right down. To have a better view, I can just put my patient's hand in a pronation, and I will then come across the head of the ulna, which I can grab dorsally and ventrally. If I leave my thumb just here and go a little more distally, I will then come across the side of the ulna. To find the radial head, the head of the radius, I will go back to my olecranon and then find my lateral epicondyle. Then I will go more inferiorly of it, finding a ditch and then another bony structure, which is the head of the ulna. For this, I can pronate and supinate, and I can feel this head of the radius moving. After this, to find the shaft of the radius, I will now go and kind of go towards my thumb and palpate it up. Palpating the shaft of the radius. And that is all. Thank you.